get started? Please. In case any of you are worried, your presence here does not indicate that you're going to retire, A. And B, the administration is not taping this meeting, so you don't have to worry about them calling you up. This meeting is being taped by the union in order to be able to show it to people who cannot be here. So we will have it, and we will have it up on our website when Brother Tierney gets the disc to us. And he's very fast, by the way. He's very fast. So you're going to be here this afternoon. Some of you are repeaters and three-peaters, as we say now in the sports world.
Copy exam, that's why you gave me. I was last time.
What's that?
It was very typical exam last time.
That's right. That's right. So there's some new faces here, and that's good. Feel free to ask whatever you like, to talk about whatever you like. Particular things that are relevant only to you, I would ask you to be cautious about doing that. But general kinds of questions are certainly always appropriate to any of our guests today. So let's get going with my favorite administrator at URI, who is an authority on anything to do with fringe benefits at URI, and that's Pat Victoria. And if you have not met her or have not talked to her, if you're really thinking about retirement, call her. Don't waste on doing anything else, but call her, set up a meeting, and she'll guide you through, which is really a very easy process. Patricia, please.
Thank you. Thank you. Hello. All right, so today we're going to discuss the different phases of health insurance choices in retirement. So I have a page on each one of these explaining them, but this is the progression of health insurance when you first retire. So first there would be COBRA, which is the same medical, dental, and vision benefit as an active employee that can last for up to 18 months. And then if you're not yet 65 at the end of those 18 months, you go into what's called the early retiree plan, which is the same medical and prescription plan. It doesn't have dental and vision, and you're covered up to age 65, and then you're eligible for Medicare. So right now we have a choice of 2 different Medicare plans, which I'll explain as we go. There we go. All right. Oop. Okay. So COBRA is an extension of your active medical benefit. It's the same medical, dental, and vision plan that you have now. The medical benefit, however, is only available to pre-65. Dental and vision you can take if you're 65 or over, but not the medical portion. Spouse and partners are eligible for the same type of benefit. And on the next page, we'll see what the prices are, but a 2% admin fee is included in the price of all the plans. Okay. Actually, I'm going to skip to, if you look in your packages to the next page, there's a full COBRA listing of all the prices and the choices that you have. But basically, you can pick and choose any portion that you want, the medical, dental, individual. It's piecemeal, so you can choose whatever you'd like. And I gave this second page here, which is not on the screen, but in your packet, because lots of times if you're eligible for Medicare, a lot of people still want to take the dental and vision, and it's less expensive to take dental and vision as 2 individuals rather than a family, because on this chart, which is not there, but in the packet, a dental and vision plan is 3 times as expensive as an individual plan, for a family plan. So you want to take 2 individuals, and you can do that, and that's why I included that. But you can do it individually. Any COBRA questions? Yes?
Can you take the medical also as 2 individuals or not?
You can, yes. Everything you can do on an individual basis, as long as you're under 65. Yes, sir.
After age 65, can you take the dental and vision?
Yes, yes, you
So
can.
those you can take?
Yes,
even if
just
you're
not the
over-
medical piece.
Okay.
Is there another one? No. Okay. So if your COBRA ends, 18 months, you've retired, your COBRA ends, and you're still not age 65 yet, we have what's called the early retiree plan. It is health insurance for the time between your COBRA and your Medicare eligibility. There is a $250 deductible on early retiree plan. You don't have that now, but you would on the early retiree plan. There is no dental or vision that's included with it. The prescription drugs are a little bit more. Right now, your prescription drug is $5, $20, and $40. This would be $7, $25, and $45. And right now, that cost is $9.44 a month. So it is a little pricey. But we also have another early retiree plan called the value plan. And the next page in your packet is a comparison sheet between the two. But the value plan is basically less medical coverage at a reduced price, but there's a $2,000 deductible. Also no dental and vision. The prescriptions are a little higher, but the cost is $5.93 a month. So sometimes if someone's COBRA eligibility ends and they'll be 65 maybe in 2 or 3 months, they'll just take the value plan instead of the higher price plan for those couple of months and then be eligible for Medicare. You know, maybe you've already had your physicals for the year. You don't really need to go to any appointments. So this is pretty much a plan that would just kind of transition you over to Medicare. Any questions about that one? Yes.
Is there any trouble with using any of these plans outside of Rhode Island?
No, it's just like the plan we have now. It's a national plan, a PPO, which is called the Preferred Provider Organization. So even if the doctor didn't take United Healthcare, there's an out-of-network benefit for that as well. So it's not a network plan. Adria?
If you go for just the dental and vision COBRA, that only lasts for 18 months.
Right.
And then you just don't know.
You're on your own. Blue Cross sells a plan. AAA actually sells Delta Dental because AAA doesn't sell to individuals. They sell to groups. So, I'm sorry, Delta sells to groups. It's group. So you could buy Delta Dental through AAA, but you can buy Blue Cross individually through Blue Cross. Yes?
I have 2 questions. When does the 18-month period start? Is that July 1st?
It would be at the end of the beginning of the next month after you retired. As long as you kind of retired after the 15th of a month, which you always will because you can only retire at the end of an academic semester anyway. So the retirement this year is June 27th, but your COBRA would go starting July 1st for 18 months. Yes, sir.
Can retiring at the end of an academic semester mean retiring after summer programs?
No, it's June or December.
My
Yes.
second question is there anything in the state for an extended COBRA? Some other states have that.
There is, if someone is disabled when they retire, then that COBRA can go for 29 months. And upon the death of the employee or children who are losing their coverage, that can go for 36 months. Adria?
Back to the dental and vision.
Yes.
What does that entail?
Exactly what you have now. It's the same plan.
Vision is 43 a month?
No, the vision is only almost $5 a month. That's dental and vision together. Would be, what, 38 something a month?
33.38 is COBRA?
33.38 would be, I think, the dental. And then the vision is 471.
But I'm saying, for that you get, it's all that you get now, that you get now?
Yes.
Wow.
Please
Yes.
remember, she's talking right now only about people who are not yet 65.
Well, dental and vision, they can have it
I
too. Yes,
understand that,
right.
But this is for people
Just
pre-Medicare
Pre-65.
eligible.
Right. Okay. We all set? Yes, sir.
Having said the national, it's national plan, you
Yes,
said, right?
yes.
If something happen in foreign country, what will happen?
If you were on our active plan or the early retiree plan, you're still covered. What would happen is you would have to pay on a credit card where you are, get as detailed a report as you could. When you bring it back, we file an international claim form, and then you're covered. United Healthcare will reimburse you just like you were in the United States, or just like you were in your home network.
Okay, thank you.
Okay. Okay, so now you turn 65, you enroll in Medicare, and when you enroll in Medicare, there are two styles of plans that go along with Medicare. Many different companies that offer them, many different kinds of plans, but only two styles of plans. And one style is called a supplement plan, and one style is called an advantage plan. So the board has one of each. With the supplement plan, it's a portable plan that you can take to any state that you go to. There's no referrals. You can go to any doctor who accepts Medicare. Medicare is your primary health insurance, and this would be your secondary. But it doesn't have anything in it extra. It's medical only, so no dental, no vision, no prescriptions. So with a supplement plan, you would also have to buy a drug plan, otherwise known as Medicare Part D. So you would have your Medicare A and B, you would have your supplemental plan, and then you would have your drug plan if that's the style of plan that you chose. We also offer what's called an advantage plan, but that's a network plan. It's an HMO. So you have to be a Rhode Island resident. You need to identify a primary care physician. You don't need referrals to go from physician to physician. The plan that we have has some dental, some vision, and a drug plan built into it for one price. But I would caution anyone who thinks that this is a great plan. It used to be a great plan. But 2 years ago, United Healthcare drastically cut the network of physicians that accept this plan. So when people come in, if that's really the plan that they're looking for, we kind of look up on the internet if their doctor is taking this plan anymore.
Last 2 years ago, United, without warning, eliminated a number of doctors throughout the United States and a really large number in Rhode Island. And so,
Yeah.
and people had absolutely no notice about this. They tried to make an appointment with their doctors and they were told, we're no longer participating. And it wasn't the doctors, it was United that threw them out. So be very careful with that one.
Yeah. And there, like I said, these are just the plans that the board offers. There are a lot of different types of plans around. You're not obligated to go to one of the plans, but I just show you this screen because there are only two styles. So if you understand the different kinds of plans that are out there, AARP offers plans, Blue Cross offers plans. There's quite a few out there, just only two kinds. Yes?
I know, I think it's been several years, United dropped Quest Diagnostics.
Yeah.
Yeah. How does one know if a particular physician sends things out to Quest? Is that
You really
written
wouldn't.
down anywhere?
No, you wouldn't know.
Tell them,
Yeah.
right?
You would have to, yeah.
Before you go to any
Yeah.
physician? you have to
And I
find out
think
where
at the
they-
beginning when that happened, the people got caught in that, but the offices kind of know now that it's not really part of that network. So if you came in as a United patient, they may not use that lab. But you're right, it's difficult when you don't know. Now, it reminds me that sometimes people send me bills that they got because they had an anesthesiologist, they had a surgery, and an anesthesiologist doesn't take United Healthcare. If you have it in the hospital, even if the doctor doesn't accept it, you're covered because you were there as a patient in the hospital for a procedure. So you don't normally go in for a procedure and you have to be expected to choose your anesthesiologist. They just do it for you. So if that happened, even if the doctor didn't take it, you're still covered because you're under the hospital plan.
Can I have one stupid question? You said the Medicare covers everybody.
Well, everyone would need to enroll in Medicare A and B before they could purchase a supplemental or an advantage type of plan. So,
Medicare will cover. But
Yeah.
how we need a supplement?
well, and Social Security, I'm sure, is going to explain this a little more. But what Medicare covers, it only covers 80% of. So you would have to you'd have to pay yourself for the other 20 plus some deductibles. So usually people have their Medicare and then buy a plan that goes along with that, sort of to boost up or supplement the benefits that Medicare would provide.
So if we buy supplement, it will cover 100%, not 80%.
Right, that's
Okay,
correct.
thank you.
depending on the supplement you buy, this is the one that is 100%. And Blue Cross and AARP also have 100% supplements as well.
Okay,
Yes,
thanks.
right.
I can give an example of that.
Sure.
I had surgery in January of 2014 at Yale New Haven Hospital, and the hospital billing system screwed up and billed Medicare rather than my insurance. And because I don't have Part B, only Part A of Medicare, I received a bill for Medicare for $3,500. That was at 20%. So it could add up quick.
Yeah.
I mean, if you have surgery, you're in the hospital a few days, it's a lot of money. So it's well worth thinking about getting one of these supplement plans.
And as an active employee, you don't need Medicare Part B. But sometimes who's ever billing looks at someone's age and assumes that they do, so they may not bill the health insurance company. They may automatically send it to Medicare. But no matter what your age, our health insurance is not age dependent. So you could be 65 or 85 still on our plan. You do not need Medicare Part B until you actually retire. And then there's a form that you do and there's a form that I do. And when we mail it in together, then that prevents you from having a penalty for late enrollment.
Pat, wasn't it true at some point that the prices for those two plans were reversed?
Opposite.
Yeah.
Last year, the state separated the people that are in the pension system. Their health insurance changed, but the Board of Governors didn't change the medical plans that they provide. So we had to separate from the state and the board. And it ended up that for the Advantage plan, that used to be $225 a month. No, sorry, the supplement plan was $225 a month. But when they looked at the claims data, the board group of folks was a healthier bunch than the state group of folks, so they reduced our rates dramatically. So that's why the supplemental last year was $225, and this year it's $170. So it worked out to our advantage, basically. Okay, and I know Social Security will explain about Medicare a little bit more, but basically, in order to buy a supplement or an Advantage plan, you have to have Medicare Part A and B first. In 2005, Part B will be a minimum of $104.90 a month, which is deducted from your Social Security check before you get it. And there is a sliding scale that was established in 2007, according to your income 2 years prior to retirement, on how much money Medicare Part B will charge. But I'm going to leave that for Social Security.
What do you mean by minimum of?
That's the least somebody could pay. There's 4 stages, I believe, of prices for Medicare Part B. So what Social Security will do is they're going to look at your income 2 years prior to your retirement. So if you retire this year, they're going to look at your 2013 taxes, and whatever your, I think it's modified gross adjusted income is, that's how much you're charged.
Can we learn how much before we retire and choose one of these?
Well, most people, you can't choose, I mean, you can't help what it is because it depends on what you made 2 years before you retired. But most people are in the minimum range. If not, I think the next jump up is 153 something a month, and then it's they look at it every year.
This is just your salary.
It's your taxes, your taxes, adjusted gross income. Yeah.
So it's whatever other income
Right,
you have.
right. But I'm going to leave that to the experts.
The only thing that's optional to you is Part B of Medicare.
While you're an
Sign
employee.
up for Part A, and that's free. But Part B is optional, but you'd be a fool not to sign up for it, frankly.
Well, B is optional as an employee.
No,
Once
no,
you.
if you retire, when you're going to retire, you need B.
Is that true? Okay. I didn't think you could buy a supplement, but I'm going to leave that as well.
B. Now, I'm not talking
Yeah.
about this, I'm talking about Part B.
Yeah, I understand. Okay. So are there any medical questions before we get to this next slide? Any questions about how the insurance goes or where you fit in the phases? Yes.
You haven't said anything about the option of buying insurance on the state exchanges under the Affordable Health Care Act.
You can do that pre-65. Post-65, I don't believe the exchange would deal, you would have anything to do on the exchange there. So you would have to go to some type of a Medicare plan, either through AARP or United or Blue Cross. AARP is United, but it's a little different than the United that we have. Because United also doesn't sell to individuals, they only sell to groups. So AARP is the group that handles, that United Healthcare supports that group. And ours is a little group, the Board of Governors group or the Board of Education group, but it's still a group, so that's why we can offer United Healthcare. But if you called United, you couldn't buy one on your own. Okay, so SRP, otherwise known as Bruce Sunland time. Salary reduction plan. A forced loan, yes. So this was time that was banked in 1990 and 1991 during the credit union crisis. It was based upon your salary, your payout will be based upon your salary at retirement, and there's a formula here. Divided by 244, which is the average number of days worked by a faculty member, and then multiplied by the number of banked days, which is usually 29, because that program lasted for 29 pay periods. You worked for 10 days, you got paid for 9, and 1 day was banked for you. So it was promised that when you retired, you would get paid out at your current rate of pay. Some people didn't believe that, so as soon as the program ended, they took the money out. You also are able to discharge that time if you go on a sabbatical at half pay, because your salary has been reduced, so you could discharge it while you're still an employee. But most people just wait till the end and take it in retirement. So that's how it's going to be calculated. Yes?
Does this mean this is cut in half if you go to pay for?
No, it's your actual rate of pay. Yes?
I know this is probably hopeless to talk about, but how do they get 244 days? We work 9
Maybe that's a
months.
frank
That
question.
was the agreement made between the AAUP and the Board of Governors at that time.
9 times 20 is 180, though.
I'm not sure.
It is what it is.
Yeah.
That's why I started with hopeless.
Oh.
It's a silly number.
Yeah. Yes, sir.
What does that typically come out to? What's the common number after that?
If you worked the full, if you gave up the full 29 days, it's about 10% of your pay. But not everybody did the full 29. I don't know how they broke it down, but mostly it's 29 days.
10% of current salary?
Yes, of current salary. So you are paid for this 2 pay periods after your final paycheck. Your final paycheck will go as a direct deposit if that's how you have it set up. And then 2 pay periods later, this payout will come. The payout does not go direct deposit. It goes back to your department because the money is still coming out of the state payroll, but you're out of the employee database, so the direct deposit isn't flagged on your account anymore. So it'll come out as a paper check, which goes back to your department on a payday, 2 pay periods after your retirement.
If you're around, I figured it out the other day, if you're at around $100,000, it's around 11 change over the pay.
So leave a forwarding address.
Or leave it to me.
Leave a forwarding address.
Okay. I think this is, there we go. Okay, life insurance. If you have life insurance through your paycheck now, you are able to continue the basic only in retirement. We have basic, which is 1 times our salary, and then supplemental, extra. But in retirement, you're only able to keep the basic. And then what happens is we have to look at what it's valued at. A frozen value, the value of it is frozen at age 65. If you're not 65 when you retire, it'll be whatever your income is. But if you're over 65, we have a field on our programs that says what you made when you were 65. So that becomes the frozen value, but then it is reduced for 4 years. It goes down to 25% of the frozen value at age 68 and never gets any lower than that. The price is basically 40 cents per thousand, so that's about how much it would cost you. When you first retire, I would give you a bill for however months are left in that year when you retire. So if you retire now in June, I'll give you a bill for 6 months. And then every December, I send out an annual life insurance bill, and then people just pay by the year. You don't have to keep it if you don't want to. There's no cash value. It's a term life policy. So most people keep it going. Any questions about that? Okay.
Pat, how many people have turned down the life insurance?
Not many. Maybe the whole time I've been doing it, less than 10. Yeah, most people keep it. And that's me. So, any questions? No. Very good. All right. Thank you. I'll get the other one out of there. Thank you.
Thank you, Pat.
That is what it is.
Let's see, maybe we'll put this maybe over here, and maybe you could put this in your pocket or something like
Okay.
that.
I hope there are no Tea Party members in the room, because you're about to hear from the agency that they hate the most in the United States government. But it is also the agency which is the most efficient, the most effective, and has the lowest administrative costs of anything going on either in public or private sector. We ought to be very proud of our Social Security Administration. My only complaint is that the payouts ought to be bigger, but that's a political problem. But I just want you to know that we're very lucky to have Social Security in the United States. And so we're going to hear now, and take good notes of this, because this could be complicated. From first time she's here for us today is Catherine LeBlanc. Are you in Providence?
I am.
Okay, it's all yours.
Thank you. I can get my PowerPoint open up here.
Okay.
Actually, you know what? Always have Plan B, right? Flash drive doesn't work. My name is Catherine LeBlanc, and I am a public affairs specialist for the Social Security Administration. I work out of the Providence office, although I've worked in many offices over the course of my career. Just so that you know, any of the information that I give you today relates to Social Security rules. So if I say you don't have to file for Medicare at 65, that is a Social Security rule. So you need to know, like Pat says, that there might be some other rules that you'll have to abide by for your own retirement, like if you do retire early. Then you would have to take Medicare. If you retired at 62, got a supplement when you turn 65, then you would have to apply for Medicare. I've prayed for patience, but this is a test.
I think it's still loading, the thumbnails have to come up.
Yeah. Okay, there we go. Great. Okay, so what will you learn today? By the end of the presentation, you will learn what types of benefits are available from Social Security, how you apply for those benefits, do you need to qualify for them, and any documentation that you might need. So how many people in the audience have already filed for Social Security benefits? Nice. And how many people plan to someday file for Social Security benefits? So I'll keep my hand up because I fall into that category as well. Well, I've worked for Social Security for just about 30 years. Would you believe I started when I was 12? And over the course of my career, I've seen how Social Security will affect the lives of nearly every American at some point during their life. And Social Security doesn't only help older Americans, but it helps workers who become disabled and children when a spouse or parent dies. However, Social Security was never intended to be your sole source of income upon retirement. Social Security replaces about 40% of pre-retirement income. Financial planners recommend 70% or more of pre-retirement income in order to live a comfortable retirement. So in order to live comfortably after retirement, we need more than Social Security, right? We need pensions, 401ks, savings, investments, maybe to hit the Powerball. So how do you qualify for Social Security benefits? Well, when you work, you pay into Social Security taxes are taken out. Remember that old joke, who's FICA and why is she taking my money? We don't call it FICA anymore, but we're still taking your money. So this year, every $1,220 equals 1 credit. We don't call them quarters anymore because you don't have to earn them in any specific quarter of the year. We call them credits. The first $1,220 that you earn gets you 1 credit. You do this 4 times, $4,880 in earnings will get you your 4 credits for the year. You work for 10 years, earning at least the minimum. This amount changes every year. But after you've worked for 10 years, when you become retirement age, you qualify for a benefit. How does Social Security calculate your benefit? We don't take your high 3 or your high 5, like some organizations do. Social Security looks at all your earnings from the day you started to work. And then we index them. We bring them up to current day dollars. There's an indexing factor that would count for inflation. So that $7,000 you might have earned in 1976 might be worth $37,000 in today's dollars. So after we index them, we scrape the highest 35 years of earnings. So that's what's used in your computation. We divide that by 420 to come up with your average monthly earnings, and that's how we calculate your benefit. When to retire is one of the most frequent questions I was asked. Over the course of my career, I've taken thousands of claims for retirement, and that is one of the most common questions. Kathy, when should I file for retirement? Well, I can't answer that question because the best time for you is not necessarily the best time for you. It's a personal decision that you have to make based on your own personal circumstances. What's your financial situation? Do you still have a mortgage? Do you have children in college that you have to pay for? What's your life expectancy? Life expectancy is huge. Do you have longevity in your family? Are you healthy? The break-even point for someone who files at 62 is about 80 or 81. So at that point, if you filed at 62, you were ahead of the game until you reached 80. At that point, you start losing money. You lived, but you lost the gamble. So those are things that you have to take into consideration when you're choosing when to retire. Although Social Security can't tell you when the best time for you to retire is, we can help you with some of the tools that we have. And the first tool is your Social Security statement. So So how many people remember receiving that statement in the mail? How many people say, whatever happened to that, right? How many people recently got one? So we can see only a couple of hands. Yeah, we started sending these statements out in 1999. We stopped sending them in 2011 when Congress cut our budget. Any guesses how much they cost us a year to print, prepare, and mail? Over $70 million a year. So when that was the first thing to go, yep.
How did they define disability? Suppose you become disabled after you retire.
Yeah, I'll get to that. I do ask that you hold all questions. I might get to any of your questions through before the end. So the Social Security statement was stopped in 2011, but in May of 2012, we made it available online. So in your packets on the left-hand side, you'll see how to create a My Social Security account. That's how you can get your Social Security statement. And why this is an important tool, of course, it gives you the amounts that you're going to get upon 62, your full retirement age, and 70. If you should become disabled before your full retirement age, what you would get, what your survivors would get. So those are all very important calculations in order to compute how much you're going to get from Social Security. It also lists your name and your date of birth. We want to make sure that those are correct. Did you get married and not tell us, or divorced and not change your name with Social Security? Is your date of birth correct? Now we have enumeration at birth. But back when I was a kid, I walked into the office and my friend said, "You want a number?" And I said, "Sure." So we went in there and I wrote Kathy, and my mother had a fit when I got home. But those are things that you want to make sure are correct. Okay, make sure that it's your given name on there, correct date of birth. That's going to provide for a seamless retirement when you contact Social Security. But one of the most important things that we listed on that statement was your earnings. Because if I said just a couple of slides ago, we compute your benefit based on your lifetime of earnings, and a year is missing, then you're not getting credit for something that you deserve. So we wanted you to look at that, and we wanted you to look at it frequently, because you might have that W-2 that's missing just a couple of years ago, but will you have the W-2 if a year is missing 20 years ago? It makes it harder to correct. It's very easy to correct if we have the W-2. If we don't, sometimes companies are out of business. So just very important to just look at that earnings statement and make sure that you're getting credit for all you deserve. So the online statement became available in May of 2012, like we said, and we are recommending that everyone create their My Social Security account. We have over 18 million people who've already created their My Social Security account. And why would you want to do that? Well, let's say you were going to your financial planner. Most people don't remember what they did with their Social Security statement. We did start sending them out just recently in the fall of last year, but only on a limited basis. To anyone turning 25, 30, 35, 40, 45, 50, 55, or 60, you'll get one the year you reach that age, but you won't get another one for 5 years. But they are available on demand online. Once you reach age 60, if you have not filed a claim yet and you haven't established an online account, you'll get it once a year, about 3 months before your birthday. What do you need to create an account? You just have to have a valid email address, of course a Social Security number, and a U.S. mailing address. You do have to pass some pretty stringent security questions. Has anyone created their account here? Did anybody have trouble with the questions? Sometimes they are pretty tough. We want them to be tough because we don't want someone who steals your identity to be able to answer those questions. So the question might be, did you ever own a 1982 Buick Regal? Did you ever live on Buttercup Lane, Buttercup Avenue, or Buttercup Street? We call them out-of-wallet questions because if somebody steals your wallet, they shouldn't be able to answer those questions. And we get them from the credit bureaus, so that's why they can be pretty tough. We do always still believe that it's better for you to create an account than to not have one. Because if you create one, then no one else can. So I encourage everyone to go on our website and to create your My Social Security account. What's another tool that we have?
Want to wait for questions?
Yeah.
I just want to make a comment. If you have a security freeze.
Right, that's one thing that, right, you would not be able to. Yeah, thank you. If you've had any problems with identity theft, then you would want to contact Social Security and ask either for extra security. You can ask for extra security, and they could text you, like sometimes with your online banking, they'll text you a code and then you can go in. But I want you to know that we also have that, that green bar that goes across the URL if you do online banking? That's called an extended validation certificate, and we've applied for that just to get extra security. And my PowerPoint is frozen, but hopefully it'll catch up to me. So the next tool that we have is the retirement estimator. That's our online tool for helping you plan for your retirement. And how does that help you? Well, it allows you to play with different scenarios. Your Social Security statement is a good tool. It's a good starting point, but it only gives you 3 ages: 62, your full retirement age, and 70. What happens if you want to retire at 64 or 65 and a half? So this will allow you to plug in different scenarios. If you're going to stop working at 60, you're not eligible for Social Security until 62. So how many people remember on their Social Security statement that it says something about what we assume? So this is the online statement, right? But there are a couple of things that they assume. It says, we will assume for 2015 and later, this is the newest statement. I created my account online. We assume that you'll continue to work and make about the same as you did in 2013 and 2014. So if you look at that figure on your Social Security statement at your full retirement age, and it gives you $1,200, but you're going to retire at 62, that's an overinflated amount because it thinks you're going to work up until your full retirement age. So this retirement estimator will allow you to say, I'm stopping at 60. What will I get at 67? So another important tool to help you with your planning. Once you've decided to apply for benefits, the fastest way to apply for Social Security benefits is online. You can apply for retirement, spouses, Medicare, disability on our website. A retirement claim takes about 15 minutes. A Medicare claim takes about 5 minutes. If you have questions, come to seminars like this. Call up the local office. You don't have to go there and wait an hour to see someone. If you've been to some of our busier offices, Providence is a very busy place. It's in a federal building, so you have to go through security, take off your belt, take off your shoes, empty your pockets, go through the metal detector, so pay $10 for parking. So we want to save you that. We want to offer you services in the method in which you would like to receive them. If you want to do it over the phone, if you want to go into an office, you still have that option of calling an office, making an appointment to go in there to file your claim. However, once you have all the answers, once you know when you're going to retire, if you're going to work or not, all these answers, then we're just the typist. We're just going to ask you and type in all that information. So you can do it from the convenience of your home. You can have anyone help you. If you don't remember your date of marriage and you can't get your ring off, for the guys out there, do you know how many times I've had to fend off fights between couples because the wife sits back and, okay, what is the date of marriage? And then especially if you remember the first marriage, it's bad. So I encourage you to feel safe to file online. Actually, right now, more than 50% of our applications for retirement are filed online. We're looking to get 67% because there are 10,000 baby boomers turning 62 every day. And we have another 10 years of that. We won't be able to handle all that. So we need your help. We want you to ask us any questions that you have, but feel comfortable filing online. Okay, once you've decided that you are ready to file for your Social Security, when do you file? You can file a claim up to 3 months in advance. Don't file 6 months before you're 62 because your claim would get denied. It's too early. What are the questions we're going to ask? Well, we're going to ask about spouses and ex-spouses. Were you ever married to someone for 10 years? Are you currently married? Some people can get benefits on an ex-spouse's record. Some people can get, ex-spouses can get benefits on your record. That's a lead for someone, for us to follow up on. We're going to ask, do you have any children under the age of 18? Do you have any children under the age of 19 and in high school? And do you have any disabled children? We can sometimes pay adult disabled children. Children who were disabled before the age of 22, who are unmarried and not working in a substantial capacity, can sometimes get benefits regardless of their age if they were disabled before the age of 22 and are still technically dependent on you when you retire. We're going to ask if you were ever in the military service. Sometimes we can give you extra credit for that service. We're going to ask you, are you eligible for a pension that you did not pay Social Security taxes on? Does that apply to anybody here? Did anybody pay into like a city or the state government and you'd be eligible for 2 pensions? Okay. That can sometimes affect the way we calculate your benefit. We're going to ask for your bank information because all payments must be made by direct deposit. And of course, we're going to ask, what are your work plans? So how many people here know that you can still work and file for Social Security? Yeah. So the full retirement age has changed. If you're not sure where you fall in, here's the chart, and it's also on page 9 in your Understanding the Benefits booklet. So the full retirement age has changed. It's maxed out right now to 67. People retiring now at this point in time, their full retirement age is 66. Even though the full retirement age has changed, you can still file as early as age 62. You get about 75%. For somebody born in that period from 43 to 54, their full retirement age is 66. At that point, you get 100%. But if you delay your retirement past your full retirement age, we will give you 8% extra per year for every 12 months that you delay your retirement. Nowadays, where are you going to go and get 8% on your money? It maxes out at 70. It stops growing. You'll get 132% if you decide to delay your retirement up until age 70. Some financial planners recommend, if you plan on working, if you want to maximize your Social Security till age 70, and you are either currently married or were previously married at least 10 years, and your spouse is at least age 62, your ex-spouse, or your current spouse is at least your full retirement age, they recommend something called file and suspend. Has anybody heard of file and suspend? Has anybody taken advantage of file and suspend? Great. So it sounds too good to be true, right? File and suspend. Well, how does that work? Well, you both have to be your full retirement age. One spouse files the claim, suspends their payments. They don't receive them. The other spouse files and starts to collect half of the spouse's benefit. Because they're not receiving their own benefit, they continue to build theirs, and they get the extra 132% at age 70. So for example, my husband and I are both full retirement age. We get our Social Security statements. His benefit at full retirement age is $3,000. My benefit at my full retirement age is $2,000. One of us is going to file and suspend, and the other one's going to collect half. Well, half of $3,000 sounds better than half of $2,000 to me, so I say, sorry, dear, but I'm the one getting the check. Let's file. You file and suspend. I'll file, start to collect $1,500, half of his $3,000. I collect that every month for 4 years, and then at 70, I stop that, and he unsuspends, and we both start to collect at 70, 132% of our benefit. File and suspend. Any questions on that? Just remember, it has to be only at full retirement age.
That's a very tricky thing to apply for. I can't find any way to do that online. You basically have to go in and get Social Security.
Yeah, if you put that in remarks, though, if you file the application on your own, and then you put in remarks, I am filing and suspending my benefit so that my spouse can collect half of mine, they'll contact you and they'll be able to do it. The other thing is, if you were married previously to a spouse at least 10 years, you can do that on your ex-spouse. Even if you have an ex-spouse, and we don't call them up and tell them, so don't worry. But if you have an ex-spouse that you were married to at least 10 years, and you are unmarried, you have to be unmarried for this, you can collect half of your ex-spouse's benefit and file and suspend. They don't have to have filed, though. You can file, collect half of your ex-spouse's and build yours up. If your ex-spouse is deceased, you can also do that. Obviously, we don't care of the age because they're deceased, but you can be remarried if you were remarried after the age of 60, if the spouse is deceased. Yeah.
I just want to make sure that in that scenario, the spouse, they do not receive their own Social Security benefit at all, and you only receive of theirs,
Correct.
in which the spouse receives their 100% and you're receiving half?
They could. They could be receiving it. Yeah.
So in other words, they could just.
But that wouldn't be file and suspend. That would be, he would be filing, and you would be filing on his, and well, actually, you would be suspending your own, but,
Okay,
yeah.
so one person can suspend, the other person gets, so it's 1 1/2 times.
Right, because that's the normal calculation for a spouse. A spouse is eligible for 50% of the worker's benefit, even if she never worked a day in her life or he never worked a day in his life.
So situation, a divorced couple, and I'm gonna say, I'm thinking of someone, the ex-wife goes for half of the husband's Social Security. And then if he remarries, she still gets her half,
That's correct.
and then his new wife would get that.
That's correct. So if there is an ex-spouse out there who remarries, if he found 3 women that he wanted to marry, and he stayed married for 10 years, all 3 could get benefits without regard for the other. They don't reduce anyone's benefit in the ex-spouse situation. Yes?
In the file and suspend option that you were discussing with the spouse receiving half, did you say that both could continue to work, and then you said when they reach 70, they could both draw the 130%?
Yes. Yep. So nice segue into my next slide, so thank you. Yeah. So can you work and still collect Social Security? Yes, you can. Once you reach your full retirement age, there's unlimited earnings. That's why you can file and suspend at your full retirement age and keep working. If you want to retire early as age 62, we do limit your earnings. So this year, the limit for someone who's 62 through the month before, the year before they turn their full retirement age, it's $15,720. That's what you can earn and still collect checks for the whole year. The year you reach your full retirement age, we're only going to look at the months before you reach your full retirement age. So if you turn your full retirement age in July, then we're going to look at January through June. Will you earn more than $41,880 in those 6 months? Because once July comes, you have unlimited earnings. If you are planning on retiring, but you want to work part-time, and you think you might go over the $15,720, but you're not going to go over that much, we're going to count $1 for every 2 that you go over the limit. So example, I'm 62 years old. I look good, right? A woman actually at the end of the presentation, she said to me, "Oh, we have something in common." I said, "We do?" She said, "Yeah, I'm 62 also." I said, "Ma'am, I'm not 62. She said, "Oh, good, because you look so much better than I do." So anyway, I digress. But anyway, yes. So I'm 62. I file my benefits effective with January. And I work out a deal with my previous employer that she wants me to come back and work for her. I say, great, can you limit my earnings to 15,720? She says, no, but we need you for more hours than that, but we work it out, and it comes up that she's going to pay me $25,720 because I'm bad at math. That's $10,000 over, but Social Security's only account $1 for every 2 that you go over the limit. So out of that $10,000 that I'm over, Social Security's only going to look at 5. If my monthly benefit is $1,000 a month, they're going to hold January, February, March, April, and May, start paying me effective with June, even though I'm earning $10,000 over the limit. Same thing kind of applies in a lesser example with your full retirement age. Unless your full retirement age is December, the $41,880 would apply, but we're only going to look at same scenario, except we're going to divide it in 3 instead of in 2. Like we said, the month that you reach your full retirement age, you have unlimited earnings. Social Security continues to grow until 70, and then it stops. So you would want to file for your benefits at least by age 70. Medicare, even though the full retirement age has changed, Medicare is still available at age 65. Anybody who is 65 and has their 40 credits or has a spouse who has 40 credits can get Medicare. If you've been receiving Social Security disability for 24 months, we offer you Medicare. If you've been diagnosed with ALS, or if you have permanent kidney failure or on dialysis, or have had a kidney transplant, and even if you're still working, you can still file for Medicare. Medicare does have 4 parts, like Pat said, A, B, C, and D. Part A is the hospital insurance, premium free. Part B is the troublemaker. That's the one that has all the rules for enrollment, which I'll get to in a minute, but that covers 80% of a reasonable charge after a $147 calendar deductible. This year, the premium for most people is $104.90. If your modified adjusted gross income is greater than $85,000 for a single person, $170,000 for a married person filing jointly, you may have a modified formula in calculating your Part B premium. Part C is our Medicare Advantage plan. It's like an HMO, like Pat had gone over. It's available in some states. It's restrictive, got to stay in network, all that happy stuff. Part D is our prescription drug plan. Parts A and B you file for with Social Security. C and D you file for with your health care provider, whoever that would be, United Health or AARP or Blue Cross. We don't pick a plan for you. You would decide which plan you would choose. Medicare has certain enrollment periods. Generally, Part A is not the fussy one. You just file right around the time you're 65. We'll give it to you the first day of the month you turn 65. No penalties involved. If you file late, we'll go up to 6 months retroactive. It's really easy. It's like the youngest child. But Part B is the troublemaker. That's the middle child. That has a very specific enrollment periods. If you are going to continue to work at age 65, let's say you're going to continue till your full retirement age, and you're working and you're covered under a group health insurance plan based on your current employment, you don't need to take Part B and pay $104.90 or more per month. If you're covered under a group health insurance plan based on your spouse's current employment, you may be retired but they're working, you don't have to take Part B of Medicare. Social Security rules. Pat might have something else. Jump in if you think it's necessary. The penalty for filing late for Medicare is a 10% surcharge for every year that you don't take Medicare that you could have, unless you were covered under a group health insurance plan based on either your employment or your spouse's employment. You can delay it. Okay? If you miss your general enrollment period and you don't qualify for a special enrollment period, or you don't have your 40 credits, anybody can file for Medicare January, February, March of every year. It's not effective until July. But the penalty would come into play if You were 65, you didn't have credible coverage based on someone's employment, you decided not to take Part B because you were healthy, or you had, sometimes veterans will do this because they have the VA, or they have Champus or something like that, and they decide that they don't want to file for Part B. We don't make anybody file for Medicare Part B if they don't want it. But just be aware, if you don't have credible coverage based on someone's employment, it could cost you extra when you do want it. If you turn 62 and want to retire, and we don't offer Medicare until 65, in January of 2014, President Obama passed the Affordable Care Act was passed. It's available on the healthcare.gov website. Here, if in the state of Rhode Island, this is a national website, but in the state of Rhode Island, if you do put your zip code in, it will transition you into your state plan. But it's a good option for people who don't have any other options for health insurance from 62 to 65. Once you turn 65, you would then go on Medicare. Medicare is not part of the Affordable Care Act, so you would then get a supplement somewhere else. What other benefits do we have from Social Security? Social Security has a disability benefit. One in four current 20-year-olds will not make it to retirement. They will become disabled. Social Security has a protection for them on a disability. The definition for Social Security disability is different than private insurances or other government agencies. We don't have any short-term, we don't have any temporary disabilities. You're lucky here in Rhode Island you have TDI that will cover you at the beginning for short-term disability. Social Security's definition of disability is the inability to engage in substantial gainful activity and be totally disabled. Have a condition that will last for at least 12 months or result in your death. So you have to pretty much not be working, or that substantial gainful activity level is 1,090 a month, so you have to be earning under that. It's only available up until you reach your full retirement age, and then there's no more disability after that. And why is that? Well, Social Security disability pays you your full retirement age amount. That's the only benefit of filing for it early, is because you don't take, if you file at 62, you can file for retirement and disability at the same time. So some people retire early because they're not able to continue to work. They are totally disabled, and they don't realize you can file for retirement and disability. You can file at the same time. We'll stop paying you your 75% at 62 while you're waiting for a medical decision to come. A medical decision takes about 3 to 6 months. While you're waiting for that, your Social Security retirement payment can be coming in. And then if you should become approved for disability, we'll boot you up to the 100%. So it's a good deal. We have surviving children's benefits for the same thing, children under the age of 18, in age 19 still in high school, or a disabled adult child who was disabled before the age of 22. Widow's benefits begin as early as age 60, or if the widow is disabled or the widower is disabled, it can start as early as age 50. If you are a widow and you have a child under the age of 16, regardless of your age, as a widow or widower, you can start to receive survivor benefits. If you're caring for a disabled adult child, or if that child over the age of 16 needs you to care for them, those benefits can continue once the child reaches that age. Divorced widows or widowers benefits we talked about a little bit earlier. Same thing as spouses benefits or widows benefits, except you have to be married 10 years, and if you were remarried, it had to have occurred after you were age 60 for regular widows, 50 for disabled widows. One last word, the last program that we have, a disability program called SSI. It's basically a federal welfare program, supplementary security income. It can pay some children who are not able to work, some adults who don't qualify for Social Security disability or don't have their credits, and some people who are 65 or older who have limited income and resources. We're in tax season. I hope everybody took care of that this week. Wrote my check out and cried. No. But anyway, its favorite topic, taxes. Will your Social Security be taxable? It could be. If your adjusted gross income is greater than $25,000 if you file single, $32,000 if you filed a joint return, a portion of your Social Security would be taxable. We don't give you tax advice at Social Security. We don't tell you whether or not your Social Security would be taxable. We send you a 1099 at the end of the year, the beginning of the year. We will, if you go to your tax professional and they recommend that you take federal taxes out of your Social Security check, we can do that for you. You complete that form, W4V. You can Google that and send that into Social Security. But just remember, that's a one-way train to the IRS. And there is no backing that train up and getting the money back. You file your tax refund to return to get that money back. The 4 percentages you choose, 7, 10, 15, and 25. Well, that was a lot. Who's ready for a test? Okay, just to recap, you've learned about our website, socialsecurity.gov, all the things that you can do on there, file for benefits, create your My Social Security account. Any pamphlet that is in your packet, any fact sheet or pamphlet, any pamphlet out that I have on the table out there is available on our website in at least 15 different languages if you're interested. Up to date and on many, many, many topics that you might be curious about. You've learned about our useful retirement tools, your Social Security statement, the importance of looking at that, not only for the calculations, but also for making sure that your earnings are posted. You know that you can work and file for Social Security benefits and how that will affect your benefit. Once you have your Social Security benefit online account, your My Social Security account, and you file for benefits, there are numerous things that you can do with your account. You can manage your benefits online. You can request a duplicate Medicare card coming soon, a duplicate 1099, get a benefit statement, proof of income, change your address, your direct deposit, your mail, your telephone number, all those things you can do online once you create your account. If you have a pressing question at 7 a.m. or 7 p.m. and you want to call our 1-800 number, we do have teleservice representatives available to help you out. Don't call around the 3rd of the month because that's a busy, busy time for us. But they are available at 1-800-772-1213. That number is also on the inside cover of your Understanding the Benefits packet. I hope I've answered all your questions. If not, check out our website, try and get that answer on there. You can also check us out on, you can like us on Facebook, you can follow us on Twitter, you can watch us on YouTube, you can even pin us on Pinterest. I've watched us on YouTube, and I've liked us on Facebook, but I haven't pinned us on Pinterest. If you go on our website and you look for this little envelope, you can sign up for updates with Social Security. In January, when the cost of living increase was announced, there was a press release. I got an email right away. I knew before many employees knew that that was passed. So please check us out. We also have webinars on different topics, especially Ticket to Work, getting people who are on disability back to work, back into the workforce. We are celebrating our 80th birthday this year. So Social Security is turning 80, Medicare is turning 50. And now, any questions? Yes?
You brought it up earlier. The question of prior employment where there was a pension but no Social Security.
Not called a windfall of some kind. Could you? There may be people in the room that have that situation.
Okay. So the windfall elimination provision applies to someone who worked under Social Security and got their 40 credits, and then maybe stopped and went to work for a municipality or a commonwealth like Massachusetts. I live in Massachusetts. I did a retirement seminar for a bunch of cranky teachers who this windfall elimination provision was applying to.
They hate it.
They do hate it, but you know, I just think that it's because they don't understand it. So I try my best to explain. So if you are eligible for 2 pensions, one that you pay Social Security, that's your Social Security pension, and one that you didn't pay Social Security taxes on. When we calculate your benefit, we're going to look at a different way. The way Social Security was established back in 1935 was to keep people out of the poorhouses. So that was a social program. So the less income you have, the more of a return you get on your money. When you are eligible for a pension that Social Security doesn't know about, because we didn't, those earnings, we didn't take Social Security taxes out, we think you're a lower wage earner. Those people get about 55% of a return on their money or more, depending on how low their income is. For those of us who work under Social Security, myself included, we're only getting a 40% return on your money. So those people were getting an unintended windfall. So the 1983 amendments corrected this unintended windfall, and it changed the calculation for those people who were eligible for another pension that they didn't pay Social Security taxes on. So that's why we corrected it. That was part of the reasons the trust funds were in trouble. The 1983 amendments did a lot of things. They made a lot of changes. We're looking at making probably some more changes just due to the demographics. Social Security could have never predicted 10,000 baby boomers turning 62 every day. And those 10,000 baby boomers didn't have 10,000 kids contributing. So they call it the silver tsunami. Has anybody heard that term? So you have all these baby boomers collecting, and they're healthy. So they're collecting for a longer period of time. And we don't have that same number of people paying in. So we have less people paying in, more people collecting for a longer period of time. So Social Security was never really intended to pay someone for 30 years. And that's pretty much what's happening. When I started with the government 30 years ago, the average age for a male to live, life expectancy was 72. Now it's 82. But everyone in here probably knows somebody in their 90s collecting Social Security. So, and that's good, but it's something that we need to look at. So we are looking at changing some of the things. Congress is looking at that, changing the retirement age possibly, changing the FICA maximum. Right now, you stop paying Social Security taxes on any wages over $118,500. So maybe they're going to increase that wage base. Maybe they're going to increase the retirement age again. So those are things that they're looking at. Does that answer your question about the
Well, no, because isn't it true, I know for me, that I had work time in Massachusetts.
Okay.
Before Massachusetts, public employees had Social Security, okay? And they just had the Massachusetts pension.
Yeah.
And so I know that I had to work more under Social Security to avoid that windfall tax.
So that's one of the an exception to the windfall elimination provision. If you have 30 years of substantial work under Social Security, and substantial work is about 25% of whatever the Social Security maximum is for the year, that means that you've invested at least 30 years under Social Security, so we will pay you your full Social Security and your without regard to any other pension. But that is one of the exceptions, yeah. Go ahead.
So if you turn 65 and you're not going to file for either Social Security or Medicare, do you still have to register?
Yeah, we don't ask that you register. No one has to file for Medicare at 65. Some people, there's two schools of thought on whether or not you file for Medicare at 65 when you're continuing to work. Some people say, well, it's free. I can file for Part A. If I end up going to the hospital, Medicare will pay something. It'll be a secondary payer, but it might pay something. Some people don't want the hassle of having two insurances. Okay, so we don't contact you. There's no letter that we send anybody. The only people that I would recommend not filing for Medicare at 65 is if you have a healthcare spending account through a bank, not through work, not a flexible spending account, but a healthcare account with a bank. If you file for Medicare, that will disqualify you for that. That's the only time I would say definitely don't file for Medicare at 65. Yeah.
You mentioned earlier about the break-even point, assuming 62 years of age retirement. Is there a table about break-even for 63, 64, et cetera, all the way up to 70?
I don't know of one. That's just an average that we come up with. for 62. I'm sure there are some calculators on there, but I don't know of any. Yeah.
You mentioned when someone starts to collect that full-time retirement, and you said for a single person, taxes begin on Social Security at $25,000 a year,
If-
not 34, 25?
Right. If you file a single,
It's only 25,000.
25,000. Yep. Taxes are, I believe it's in that understanding the benefit booklet. They talk about taxes on page 12. Yes.
Thanks for a really clear and logical presentation,
Thank you.
and for dealing with the technical difficulties that we all have experienced too, I'm sure. And my question is sort of about a technical difficulty. For the reasons you mentioned we might, I would like to use that online
Retirement.
benefits estimator to see what would happen if I retire and then don't begin collecting benefits until a certain later point. When I go to that estimator online and I click on it, I get a message saying you're not eligible to use this service.
Have you
I did
filed a
that
claim?
today, and that happened, and it's happened in the past. I didn't go that far today, but in the past, I then got a message saying you can download our special calculator instead of doing it online, but sorry, this is not available for Macs, only for Windows. So I hit a brick wall. Is that a problem you've heard of?
I have not. No, but I can, yeah, you have. I have not heard that at all.
Okay, it's happened to me.
Yeah, some of the things that you can't access, once you file for Social Security, you can't get an estimate from us because you're already collecting a benefit. One of the other things that I wanted to mention too, there are so many things that I could mention about Social Security. I think that's why I keep notes so that I don't forget. But I do wanted to mention that when you continue to work, even if you draw your Social Security, so we say, you can file at your full retirement age and still work full time. We are always looking at how much you're putting into Social Security. And we're always recomputing your benefit to give you credit for those earnings. So those 35 years are a rolling 35 years. We're not going to compute your benefit. Once you file, we never look at it again. We're always looking at it.
Even after full retirement age?
Absolutely. Yep. So if what you're earning replaces a low year of those 35 highest years that we've used, we'll recompute your benefit and give you credit for those earnings. Yeah.
Does that rolling affect the 50% which the spouse receives?
The recomputation does. The only thing a spouse does not get 50% of is if you delay your retirement. Because you chose to delay it, that's only for you. And then when you pass away, your spouse will get it. But the recomputation increases your full retirement age benefit, and so yes, the spouse will get 50%, yes.
What's the current maximum payability?
People ask that all the time. You think I would write it down. It's available on our website. I don't believe I have it. It gives in, I think in the back of the retirement booklet that I have, it gives like the average, but thank you, I'll look that up, but and it is available on our website. Any other questions? Yes.
I'm 64. I plan to retire, but I'm getting a pension from my current job if I retire. That pension going to be my income and taxable?
I really don't get involved in tax questions. That's not really a Social Security question.
I mean, Social Security, if I retire, I get Social Security money. I have a limited income to avoid any extra tax. So,
Well, if you're talking taxes, then that's a total separate issue. But that $15,720, that limit is only for wages if you go to work. That doesn't count for any other income that you might have. Any unearned income is, we don't look at that under Social Security.
So it's only earned income, not
Correct.
dividends or
Correct.
interest.
Or pensions. Yep. Yep. Any other questions? All right, well, thank you for your
Thank you.
attention. I apologize for the technical difficulties. I will be available if you'd like for a little while outside to answer your questions.
Folks, for that.
Great recovery.
Thank you, thank you. Well, you know, you gotta do what you gotta do. So, I apologize for that, another technical glitch. I'm Liz Armstrong. I am with TIA-CREF. I am a wealth management advisor out of the Providence office. I believe I have met with some of you in the past, and possibility you've met with some of my colleagues out of the office, whether it's in Providence or out of our Boston office. And what I am going to go over today are your income options. We'll talk about income options. I don't know if there's anyone here who is not part of the TIA-CREF plan, because some of these options may not apply to your VALIC or MetLife, but we will try to keep it as generic as we possibly can. But a lot, like I said, a lot of our presentation will pertain to your TIA traditional, as well as your other CREF and mutual fund options. So. Hold on. Here we go. So, what we want to talk about is determining your needs, your expenses, cash flow, withdrawal and income options, and then, you know, steps that you can take today. So a lot of what I tell people when we're starting to prepare for retirement and thinking about income, what we do is we will go through a scenario of what is your lifestyle like today, and trying to maintain that lifestyle through retirement. So without having to really, you know, you want to be comfortable. Let's put it that way. We want to take everything into consideration. We at TIA-CREF retire you, plan for you out to age 95. We find that our folks tend to live a little longer than what is usually calculated at maybe some of the other companies. But 95, I mean, I still have some clients that are about 96, 97, and they're still taking their TIA annuity, so it's worked. And we are going on, in 2020, we will be 100 years old. So clearly what we've done has helped folks. In the packet, the TIA-CREF packet, there's a couple pieces in there, and along with the brochure that's in there, what I did is I put in a few other things that last year I got a lot of questions on, and we will get to some of the other things. But one of the things that you want to start thinking through when we talk about maintaining lifestyle is your budget. So I did include a budget worksheet for you, because a lot of folks, when they're going through their budget, don't think, there's a few things that they just don't, they miss. So I put this in there as just a little reference to just, again, start thinking through expenses. This is something we also heard from Kathy in Social Security. You know, where is the income coming from? You have your savings, you have your retirement plan, you have Social Security, and we take these, and these are the sources we're going to use to get to that goal, to get you that monthly income that you now need to replace from your paycheck. I'm not really, you know, Social Security, we heard a lot about it. We know that there's a lot to it. Everybody's different. But when we definitely take that into consideration as we're doing your planning. And I always recommend everyone to visit the website and start to look at what are your benefits. Again, calculating your expenses, that's why you have the worksheet. Don't sell yourself short. You want to enjoy retirement. Build it in. So you want your essentials, but you also want to be able to travel or go visit the grandchildren or whatever it may be. Make sure you're building that into your expense. So again, what we want to do, whether you are retiring in 3 months, whether you're retiring at the end of this year, whether you're retiring in 2 years from now, we like to sit down with your financial advisor, whoever they may be, and really start to think through the plan. So there are no surprises when you're ready to retire. I run into some situations where just one spouse has a retirement plan. So we need to take into consideration income for both. So what if the person with the retirement plan passes away? We need to make sure that your spouse, partner, whoever it may be, will be able to continue to live the lifestyle that you want them to be living, because that person could be living to 95 or 100. Healthcare, take it into consideration. We always build healthcare expense in. We typically go on the high side just to prepare. We want to make sure that you have enough emergency cash. And we also want to talk about what are the threats to retirement income. Just something in our office we ran into this week that I'll share with you when we get to that. So some of these conditions are outliving your assets, loss of purchasing power, and then returns lower than anticipated. This really pertains to how your retirement assets are positioned. Being too conservative or being too aggressive. So these are things we want to talk to you about. You need to take into consideration. If you're so conservative, yes, you can outlive your assets. Or they could be so conservative that, and I'll use that TIA traditional, which I know is a mystery to so many people. We'll get into a little bit of that. And just having too much in TIA traditional and limiting yourself to your income later on. So we will talk about that. One of the things also to take into consideration as you start to draw income from your retirement assets, something we take into consideration, again, we want it to last a lifetime. Obviously, and we hear this all the time, women tend to outlive men, have a longer life expectancy. That's actually starting to even out, we have found. So that's why but, my point being, we want to make sure you're prepared for 2 lives for a long time. So you have these options, whether, like I said, whether it's in your TIA Pref, whether it's in your VALIC, whether it's in your MetLife, whatever plan you have, different options to invest in. Now, again, this slide goes to 2012, but it also talks about, when we talk about purchasing power, if you're so conservative, and again, right now we're using inflation at TIA Pref at 2.18. But Treasury bills, they're only going to stay slightly ahead of inflation. Corporate bonds, real estate, large company stocks. You want to have a nice mix within your portfolio in order to keep up with inflation, past inflation, purchasing power. I mean, how often do we say, what did bread cost 20 years ago? What does bread cost today? I can't believe I paid $3 for a loaf of bread. I mean, yeah. So think of 20 years from now. What is that bread going to cost? You need to keep up. So being too conservative in something like U.S. Treasury bills, you lose purchasing power. And what this means is after you've paid taxes. So you've got your investments, now you're paying taxes. Think about your retirement. Your retirement has been tax deferred all this time. The government is saying, okay, well, guess what? Now you're taking it, enjoy retirement, now you're getting taxed on it. So think of not only the returns in your investments, but now you're going to be paying taxes as you withdraw from your retirement account. So I always get the question, what if the market goes down for the next 3 years? And this is the sequence of returns, as we call it. And so what that means, let's just say you retire in June and you've got this nice nest egg. You need to be positioned in the event that market is down for the next 3 years. So if you are in investments that are not going to rebound for you, think about it. You now have this nest egg and you're just drawing out. It's dropped. You're drawing, you're drawing, you're drawing. Now you need to help make that up. So again, these are things that we want you to think through as you are thinking about taking income from your retirement accounts. And we help you, or your advisors will help you thinking through that. So if you are with TIA-CREF, we have a few options. We have your lifetime annuity, which is your TIA traditional. You can start taking systematic withdrawals. Interest only, up to age 70 and a half off of your TIA traditional. Fixed period annuities, and then the required minimum distribution, which I get a lot of questions on, and we will talk about that. So with your life annuity, if you have some fixed expenses that you're concerned about for the next, whether it's lifetime, whether it's for the next 10 years, you may still have a mortgage when you retire that's not going to be paid off for 10 years. You said, well, I would be comfortable if I had an annuity an annuity payment that will cover my mortgage till it's paid off. Okay, we can do that, either through your life annuity or through a fixed period annuity. Once you do an annuity, it is irrevocable, once you start that. So it's something that really needs to be thought about. Systematic cash withdrawals. What I find, if you are not at 70 and a half and have to take this required minimum distribution, with the systematic withdrawals, it gives you a bridge from once you've retired to when we figure out what your required minimum distribution is at 70 and a half. It's much more flexible. You can turn it on, you can turn it off, you can increase it, you can decrease it. So it's a much more flexible option. You can pair that up with some interest only off of your TIA traditional. So just start sweeping the interest off of that. Again, we talked about the fixed period annuities. That's if you just wanted to do an annuity for a short, for a period of time, 10 years, 15 years. We will run scenarios for you. So, for instance, talking to someone this morning, they said, what could I get from, X amount of dollars in my TIA traditional for 10 years? What would that payment look like versus what would it look like if I spread it out for my lifetime? So we will be running that illustration for them. And then we've got the minimum distribution. Like I said, we'll get into the minimum distribution. So again, here's your lifetime annuity. You can't outlive it. Instead of a client who was the recipient of her husband's lifetime annuity. So he passed away probably 6 years ago. They took the option of joint life, and she is living in a fabulous assisted living on the east side of Providence, and this annuity is taking care of all her expenses. And it will stop once she's passed. But for her, this was perfect. And here's what I will tell you. Based on what they did, what was in their pot of money to begin with, their retirement fund, the fact that she's lived till 96 and what they've been taking, I can tell you that TIAA is now picking up that tab. They ran out of money, but with an annuity, we will pay it for life if you go with a lifetime annuity. Think of it as a second Social Security check. You can do it on a single life, you can do it on a joint life. So, again, we'll figure it either way for you. You want to take care of the spouse, that's a great way of doing it. Same thing with adding a beneficiary to it. Example, husband and wife, they do a joint, but they said, what, we travel a lot. What if something happens to us in 5 years? TIA keeps all the money. You can add a beneficiary on that income for 10, 15, 20 years.
You have 6 options, and in the other options, we are not able to
Annuitize?
no to our beneficiaries. Is it only?
No,
this?
we can customize it to you. So we can annuitize anything in your plan. Okay, we can do that. Because of the TIA traditional and its restrictions and how you get the money out of the TIA traditional, many times we will use that as the vehicle to give an annuity. But we can take in the CREF, we can always annuitize CREF and do the beneficiary. But if you may be referring to, if you have your sum of money and you're just taking a systematic withdrawal, something happens to you in 5 years, your beneficiaries get that pot of money. It's only under the annuity option that we're talking about. Oh, sorry about that. Okay, I'll let you. With the annuities, like I said, you can go with the fixed, which is your TI traditional. You can go with the variable. You can do a combination of both. What happens with the fixed? You get more of a guaranteed, stable monthly check. If you include some of your variable in that annuity, what it does is it gives you more purchasing power, but it will not give you the stability of that check. Because for instance, in 08, if somebody was annuitizing and they included their TI traditional in some of their craft, in 08, their payments would have gone down. If they had just annuitized and used the CREF guaranteed portion, you have a much more stable income going through these ups and downs. I find most often people just use their TIA traditional to get a guaranteed, stable monthly check. We have what we call a transition benefit. We don't have many people that use that, but it is an option. Again, you can get a 10% during the first year, but it will reduce the subsequent payments. Like I said, very rare that we see anybody do this, but it is. You can get a 10% lump sum from your TIA traditional in the first year. But what will happen when you take that lump sum, it's now going to reduce the remaining payments because you took 10% out.
You can take all of it out, can't you? Take 2% plus.
On your TIA traditional?
Yes.
No.
You sure about that?
If it's in your, what's the contract, Pat, that you, Yeah, I know, but the contract that you contribute into, what?
Oh, on the supplemental?
Yeah, the supplemental contracts you can, but on the, the retirement annuity that the school is contributing to?
There are TIA contracts that allow you to take a one-time payment of all of the TI traditional and pay 2%.
Under the supplemental plan,
The
What you mean by
the voluntary plan.
It's the money that, not the 5 or the 9, it's anything that you put in over the 5%. But
So
your-
we can't do that. We can't take out the total TIA in one lump sum and pay the 2%?
Not on the mandatory side.
Gotcha.
Yep.
But we show you options on how you can do it other than just annuitizing it. But no, it's not available for lump sum. So when we talk about the systematic or the lump sum, again, on the TIA traditional, another option is if you do not annuitize it, you can take it over 10 payments, 10-year payments. It gets paid out once a year. Under the CREF, it's much more flexible for you. Systematic withdrawals, again, a great way of either supplementing when you start to take your required minimum distribution that may not meet your needs during retirement, may fill in that bridge of Social Security. Systematic withdrawal to required minimum distribution does kick in. Now, if you just withdraw everything, you take everything out of your retirement plan, that's when you have a big tax bill. So that's why I say you want to manage that one. This is the interest only that you can get on either contract, your supplemental contract or the retirement annuity contract. And on the interest only, that stops at age 70 and a half when you have to start your required minimum distributions. This is your fixed period annuity. Again, it doesn't have to be for lifetime. It can be for a certain number of years. The shortest amount of time is 5 years. Yep.
Go back to the previous slide.
I'll give it my best shot. Let's see.
That said something about
This one?
may continue past 70 and a half if still employed. Will that apply to any of us?
Mm-hmm.
We can get anything back if we're still employed? Can we get any money out of those retirement accounts?
It depends, yeah, I mean, the employee contributions.
Except for the supplemental.
On the voluntary.
Besides that.
Until you retire, no, it's in there.
Doesn't really apply.
Yeah.
But if you're still working, right,
Right.
at URI.
Right.
The money you have accumulated at URI, you don't have to take any minimum distribution of 70 and a half.
Absolutely, you're absolutely correct.
Okay. But if you have money that you earned in another pension plan somewhere else, okay, at 70 and a half, you have to take the minimum distribution.
That is correct.
Okay.
So IRAs, SEPs, if you worked at Ohio State, what you have the ability to do is roll it into your TIA CREF to defer those required minimum distributions.
But you don't have to touch it.
Correct.
I just want to ask, when you talk about TIAA in some situations and CREF in some situations, I don't understand what the difference is. Could you-
Sure. So the TIAA
Yes.
is the guaranteed portion of your retirement.
Do you also mean traditional? When you
It's
say-
traditional.
Okay.
It is traditional.
Okay.
You get a guaranteed fixed rate of return, and the CREF is going to be the variable mutual funds portion, okay? The CREF is always going to be the most flexible.
What about real estate? Is that CREF?
That's flexible.
Okay.
Yes. Yeah, so that's not locked in. It's just like I said, the TIAA is where we really want to manage around that and really pay attention to how that's going to work for you in retirement, what to be thinking about. I will give you an example. We were talking about this client yesterday in the office. Late 80s, was just living off, all in TIA traditional, wanted to be safe, wanted that money to be safe for retirement, and we get that. But because of the restrictions on it, and he said, well, the required minimum distribution will meet my needs. Okay. It was meeting his needs when he first did it. What he did not anticipate is how sick his wife is today. And all his money is in the TIA traditional. And there is nothing that can be done about that. When TIA becomes liquid is if you pass away and it passes on to your spouse. That TIA traditional now becomes flexible and liquid. So that's why I say we really want to plan on how that TIA is going to work for you during retirement. And we do understand the safety and the security it offers you. But we also need to make sure you don't restrict yourself later on. Again, just kind of going back to the fixed options. A minimum distribution. Now also, what I did in that folder, because I did get a lot of questions last year on this, I gave you a little bit of a information sheet on here of when you have to take required minimum distribution. Like we said, as long as you're still working, you're over 70 and a half, you don't have to take your required minimum distribution. Let's say you decide to retire at 79. The calculation, which I also, and we will always calculate this for you, we will continue to assist you on that, and we will do the calculations every year for you. This is the calculator that the IRS uses right here. So what happens at 79, anything that's been deferred up until this point, we will use the divisor based on your balance as of year end from the prior year. So you're 79 this year, you're retiring, your balances in your retirement plan as of 12/31/2014 was $500,000. Well, if you were 70 and a half, we would divide that at 27.4. However, it's now 19.5. That is going to be a much larger number that is going to be required that you take out of that account. The longer you wait, it doesn't go back to what the calculation would have been if you took it at 70 and a half. Things we take into consideration. On the first year you retire, do you take that minimum distribution the year you retire? You have a one-time option of deferring that first payment to the following year, as long as you take it by April 1st of the following year. But keep in mind, you will need to take 2 payments that year.
You are paying a stat tax?
Do you pay what? I'm sorry?
What about the tax?
Oh, yeah, you're going to pay. Yeah, we're going to withhold taxes for you. We withhold, depending on your tax bracket, will depend. And I also find that it takes a year, sometimes 2 years, to kind of figure out what is, retirement, the first 1 or 2 years is kind of a trial and error. Could be, up next year, I need you to withhold more. Oh, guess what? I got a big check back. I don't need you to withhold as much.
So is it because the arrangement we pay less tax, or because it is less tax?
You're going to pay, depending on what you take out and what your individual situation will be. We will want to, again, if you're retiring this year, you may want to withhold, because you have, think about it, this year, if you retired this year and you have to take a required minimum distribution, you also have earned income from this year, for the first half of this year. So now, you also would have to take the income, you would have to pay taxes on the income of the withdrawal. So, and this is why we always like to take a look at what's going to be the better option of, do you defer it, but yes, you're going to have to pay taxes based on where that tax bracket is going to put you, from both the earned income and the distribution. Sure.
So if it's not a minimum distribution, it's just a lump sum withdrawal, is the tax set at 20%, like it is if we were active? But if it's minimum distribution, it could be a different tax?
It could be, yes, yeah, yeah. So to answer your question, yeah, distribution's mandatory 20%, yes, yeah.
But that's just the withholding tax, that's not the real tax.
Right.
Right, that's with withholding, correct. And we do withhold for state of Rhode Island. So, like I said, we're almost 100 years old. We're actually bigger than 2.92.3 billion. But what I would encourage you to do is make sure you check your beneficiaries. Think about the estate planning. Look at your insurance. And when we talk about consolidating assets, when you're getting ready to retire, and you may have opened years ago an IRA at Citizens Bank, and you may have a 403B at VALIC, and you need to start coming up with figuring out, because you're going to have to take withdrawals from all of those places. Where do I take it from? How do I take it? And by the way, if you have an IRA and a 403B, you have to withdraw from both of them. So if you just had all IRAs, you could take from the lowest paying IRA to satisfy all your IRAs. If you have, again, IRAs, 403Bs, you do have the ability right now or at any time to consolidate into your TIA-CREF plan. Simplify. Simplify with one carrier. If you do business with a Merrill Lynch and you want to consolidate your retirement assets into one location, simplify your life. That's what many people do during retirement. Before, we used to think in terms of don't have your eggs all in one basket. You're not, because you're still going to have a well-diversified portfolio. That's not having all your eggs in one basket. A well-diversified portfolio that you're going to get guidance on. But here's what I will tell you. We will help you with your income planning. We will create a plan for you. We will create a spend-down scenario for you. Where do we take what assets from? We will help you with your estate planning. This is a service that is provided to you through your plan at TIA-CREF. So there is no cost to sit down with an advisor at TIA-CREF. There's no cost for our service. It is what we do. We are salaried employees. We are not commissioned employees. We are here to help you. So, what questions do you have for me?
Can you talk about what special things happen upon this transition from accumulation to retirement? There are a couple of special rules. I just learned today that the complete withdrawal of TIA is not possible. But you also mentioned the $10,000 removal. Are there any other things that are triggered by that transition? Or that are made available, or limitations?
Your TIA traditional is going to be your most limited. That is, everything else is fluid. But like I said, you want to make sure that you're drawing down in the most efficient manner. And what I mean by that is I've had clients that will say, hey, you know what? My bond fund did really bad last year. I'm just going to draw all my money out of that first. Well, what happens when the bonds come back and you have no more money in it, and all of a sudden bonds are doing really well? I don't really anticipate bonds doing really, really well anytime soon, but I'm just using that as an example. But I'm just using that as an example. So what we like to do is help you think through that. But really, it's the traditional that's really the, when you're doing a required minimum distribution, we want you to pull it down proportionately from all of your accounts. Your traditional, whether it's CREF stock, whether it's one of your TIA mutual funds, take it down proportionately to maintain your asset allocation. Does that make sense? Because it helps reduce risk by keeping it in your asset allocation model.
Liz, are the fees that TIA CREF charge you when you're still working the same as when you retire and draw down some of this?
Same.
Thing?
Yep.
Thank you.
My husband was here at URI. I am not, but I'm about to retire. Can I bring my 403B to this craft?
Yes, you can. Yes. It is open to do it for spouses, family members, absolutely. So if you want to, as a family, consolidate everything under TIA CREF, you can do that.
21.5, as I am. I must have to pay the entire this month. So I have to take the minimum distribution. That is compulsory. That's right.
And I had a hard time hearing you, I'm sorry.
I'm 70.5.
Yep.
No, you're not.
No, when I kill the people, I'm not. The question that is that I must have to withdraw required minimum distribution, RMD. The question is that I have money both in TIA and some money also in CREF. Can I just withdraw money from one account, say TIA?
You can. Well, no. No, not under the required minimum distribution, you cannot.
I have to withdraw money from all the accounts?
Yes.
But Mark, if you're still working, you don't have to withdraw anything.
I know that.
All right. And you're going to work forever, you told me.
Yes.
Okay.
And so that's the one question. But if I have several accounts in the CREF, I have to touch every account, say CREF, and then the global. Then
No, you don't have to take it from you don't have to take it from every single one of them, but you can't take it like just from traditional.
Or either way, okay, let traditional be there. I just want to.
You just want to take it from the global?
Yeah, just one.
You
account.
You can. We don't recommend it, but yes, you can.
No, I
Yeah.
know.
Yes, but yes, you
what
can.
is to be recommended, I will decide.
Yeah, you can do that.
So the other thing is that, say 1 year I do, the first year I do like that.
Yeah.
But I think it is, then I can change it the other way.
Yes.
And the other question is that, the question, say, I do not use all the money. I'm a frugal person, I don't use all the money. So if I have the money left, I reinvest in TIA CREF.
So if you're not going to use all your required minimum distribution and you just want to reinvest
Yes.
what you're not using, absolutely. It just can't go back into the retirement account. So we can.
do a separate account.
Yep, we just do a separate account for you.
That separate account. Do they can go like a traditional TIA or no?
No.
Do
Well, yes, you could, but we'd have to set something up for you before you retire.
No,
Yeah.
yeah. The other thing is that, can I use the reinvestment to the CREF fund as usual, like the RA?
Can you use the CREF? Yeah.
CREF fund,
Yeah.
yes. And that will be the same, or they have different type of service charge or all that?
It would be under the, it wouldn't be under your, what we call institutional. Right now, you have what they call institutional class in your retirement account. When it comes out, and if you wanted to use one of the CREF funds in a, what we call a taxable account, you've already paid taxes on it. It now becomes what they call retail. The difference on the internal expense is very minimal, but it is a little bit different. It's a little different share class, but it's very minimal difference. But yes.
But, and again, if I take a money out of my reinvestment fund after retirement, that any profit or whatever, mostly profit you say, that will be taxed, but not the principal.
Right. That's correct. If you wanted to go into an after-tax type of a...
I think we should move on.
Yeah.
You should talk to your advisor.
Yeah. Yeah. Do you have an advisor that you talk to?
No, I myself got to know.
Yeah, all right.
One more question, please, and then we're going to wrap this up. Go ahead, sir.
Suppose I want to pay my mortgage first, although I will be giving 20% tax. Can I move the rest of my, whatever I have collected, into any account that I wanted? It can be done.
Taking it out of your retirement plan?
Just taking what is necessary to pay.
Pay your mortgage?
And the rest of the funds.
I wouldn't recommend it, because you're going to have to pay taxes on that lump sum of money.
Even that, suppose the circumstances.
That's kind of an individual, we'll talk about that. Yes. Yeah, we'll talk about that separately.
To finish with.
Yep.
Do I have to start withdrawing from TIA craft immediately in June, or do I have some flexible time to think about it?
You have time. You don't have to do it immediately.
April 15th.
April 1st of the following year, if you're over 70 and a half, if you're under 70, it's very flexible. You can do whatever you want.
Well, the other side of that is, could I take my RMD out of another account that I have and leave everything in first?
It has to be a 403B. It can't be an IRA. Correct. They're treated separately.
Explain that.
Okay, so let's...
The CREF stuff isn't really an IRA, it's something else?
It's just under a different IRS classification. So you can't, let's just say you have 3 IRAs paying 3 different rates of return. You can take whatever needs to come out of your IRAs out of one account, paying the lowest, but it will not, no, CREF, Valid, MetLife, any of 403B, it's treated separately.
And can the CREF accounts be moved into a traditional IRA without paying tax?
Good, you can roll them over.
So I could convert them all into the same class and then have
Yep.
the whole RMD apply to all of them?
Yes, you can.
We have a question here, please. Oh, sorry. I'm sorry.
Okay.
One more question. We really need to break this up.
What we had before.
What kind of union is it? Right. There was the
This is
question.
false advertising.
Thank you.
My pleasure. I would encourage you to contact, if you have an advisor, I left my card out at the table out front. If you have any questions and you'd like to contact me, my email's on there as well. I am. If you want me.
She's pretty good. I've used her before. I'll use her again.
I want to call you Henry for a second.
Yeah.
I want to follow up with you.
Yeah, one.
Yeah, what if I can send you an email?
You sent me an email a while ago and I was just too busy.
All right, I'll send you another one.
I'll be happy to.
Absolutely, very good. And your name is? And I sent you an email.